What are prenatal diagnostic tests?
Well, there's a lot of testing that's done throughout a pregnancy. We typically have a generic panel of blood that we draw when a patient comes into the office newly pregnant. They include things like checking for anemia, checking a thyroid value, checking for hepatitis, HIV, syphilis, rubella, which is German measles. It's always important to know your blood type, whether you're Rh positive or Rh negative. And nowadays, most offices are adding additional genetic screenings. For the Ashkenazi Jewish population, there's a host of things. For most ethnic diverse groups, we're actually offering cystic fibrosis testing. Fragile X is a chromosomal abnormality with the X chromosome that is frequently being tested for now. In the African American population, we test for sickle cell. In the Greek and some Asian populations, we check for thalassemia. So there's a host of tests that will be consulted with your physician when you first arrive at the office. Throughout the pregnancy, there are also other testings that will be performed. Some are invasive, dependent on screening test results that you have or on your age, and some are screening tests that are offered to everybody, but of course they're optional. And then we test later in the pregnancy for certain vaginal cultures. We test for gestational diabetes, which is diabetes unique to pregnancy. Each doctor will have a different game plan, but there's a standard of care in your community that will be adhered to.